Oh, I mean, that's the key. You know, people they think about scribes. Of course, there are different reasons to get scribes. For me, I think the value is in the quality of the shift. They make the shift that I work very tolerable. I'm able to get out on time. I'm able to document efficiently, carefully. And at the end of the shift, I don't feel as tired or beaten down as you would ordinarily. I mean, because they help with so many different aspects of clinical practice.
Well, there's multiple impacts. Number one, I think the experience for the patient is a lot different, as I'm sitting there talking with them and listening to them as opposed to entering data while they're going through their conversation. But more importantly, I think the patient's safety and satisfaction is because of the fact that I can actually get to more patients more efficiently is the key that they really bring.
We develop relationships with our scribes who tend to schedule with us each time. When I go into a room, I'll introduce them. They usually have taken on a persona of always smiling and being there with me. So it's a very positive relationship. The patients that I have and their families seem to do fine, not bothered by the situation. In fact, it enhances my time with them because I don't have to take notes at the same time.
So far, we've done a pilot trial and as well as integrating them early on. We've seen an increased number of patient per hour. In general, for instance, in our urgent care area, a lot of the physicians used to see about 3 to 3.2 patients per hour, and now that number is commonly up over 4.
Positively in that it allows me the opportunity to do what I was trained to do as opposed to what has been thrust upon me by regulators over the last number of decades.
We can see more patients, we can see them faster, and we can spend more time with them.
ScribeAmerica scribes have had a positive impact on our ability to see patients. We're actually seeing patients a lot quicker. Our bed to doc time has dropped down from 54 minutes to 18 minutes. We're spending a lot more time with the patients, and overall has been a positive impact on our patients and our providers as well.
Having a scribe has greatly impacted our ability to see patients in that it allows us to have more face time with patients. We've improved communication. It allows us to standardize our physicians in making sure that they go back and talk to patients, having the scribes remind them that they really need to do a better job with documentation or communication with patients. So overall, it's been a very positive factor.
They just free me up to keep moving. So when we get really busy, my scribes will gather all my information. They'll get all my discharge papers together. They will bring things to the nurses to help facilitate getting patients out of the emergency room. It really helps me out a lot.
You just go in there and instead of focusing on trying to remember every last detail, you can focus on actually taking care of the patient, giving them reassurance, spending more time with them, more face-to-face. It's what you really want to do when you're a physician.
I think it's definitely helped me get to be more efficient, see more patients, and not get hung up with doing a lot of documentation and actually being spend more time with patients.
When I'm working with scribes, I definitely find that I can see patients quickly, I can spend more time with them, and I seem to have a higher patient satisfaction when I'm working with scribes.
It has increased our ability to see patients more efficiently. It is, more importantly, it's increased our not just our productivity, but our attitude, I think, in seeing patients, because now we aren't spending all of our time documenting. We're getting to spend more time at the bedside with the patient doing what we love to do, and our scribe has enabled us to be able to do that more effectively.
It's been working very well. Well, first, I really enjoy having the scribe at my side. The scribes are interested. Many of them want to go on to medical school or nursing school. They're very intelligent, and it's really allowed me to just sit and talk to the patient and really improve the quality of the interaction I have with my patients.
It's made it much better. I love having the scribe with me in the room because I feel like I can focus on the patient. I can spend my time talking to them. I don't have to worry about taking notes or thinking through the documentation. I can just sit down and have a face-to-face conversation with the patient and not interact with the computer or piece of paper at all.
I think it's twofold. It allows you the ability to see the way we work. We see the same number of patients because we work on a team system. However, it increases the quality of interaction you have with the patient, because that same amount of time that you would have been in front of a keyboard and a computer screen, you're now actually talking to patients and their families. So I think it's really improved the whole patient care experience. I think that patients themselves have enjoyed the scribe interaction that they've had when the scribes are seeing patients with us as well. So I think the whole interaction in general has been a win-win-win for the patient, for the staff, and for the hospital.
I think in general, patients appreciate that I'm focused on them, I'm not taking notes, I'm not typing on a computer while I'm in the room with them. I can sit face to face, I can interact with family members. I think that overall, the patients appreciate that experience more. And I also find that I'm a little bit quicker about staying on top of things because I'm not sitting there trying to dictate as I work or do a power note as I work as well.